Helicobacter pylori, or H. pylori, is a type of bacteria that infects the stomach. The infection is common worldwide and affects more than a third of the population in the United States. H. pylori is the most common cause of peptic ulcer disease. A peptic ulcer is an open sore in the lining of the stomach or first part of the small intestine known as the duodenum. H. pylori can also irritate the stomach lining, causing a condition called gastritis. What are the symptoms of an H. pylori infection? Most people with H. pylori don't experience any symptoms, but when they do, it's often because the stomach lining is irritated, which is called an ulcer. Common symptoms can include pain in the upper abdomen or belly, along with nausea, vomiting, burping a lot, loss of appetite, weight loss, and bloating. More severe symptoms can occur if a bleeding ulcer develops. If an ulcer bleeds, your vomit may be bloody or look like coffee grounds, and may also lead to bloody stools or poop that looks like black tar. If left untreated, an ulcer may create a hole in the wall of the digestive tract called a perforation. Some children with chronic H. pylori infection also have iron deficiency anemia, which means that you don't have enough iron in your blood. What causes H. pylori infection? While it's unknown exactly how H. pylori spreads, it's thought to pass from one person to another through direct contact with saliva, vomit, or poop. It can also spread through infected food or water. Living in crowded or unsanitary conditions may also increase the risk of H. pylori infection. Washing your hands after using the bathroom and before eating, cooking food thoroughly, and drinking clean water can help prevent the spread of H. pylori. How is H. pylori diagnosed? Your child's healthcare provider can diagnose an H. pylori infection using one or more of the following tests. Upper endoscopy. This is the preferred test if peptic ulcer disease and H. pylori infection are strongly suspected. It lets a provider look directly at your child's digestive tract. Tissue samples can be tested for H. pylori and used to determine which antibiotics will treat the infection. Urea breath test. For this test, your child will be asked to blow into a bag after drinking a solution. The collected breath is then checked for a chemical that shows if the bacteria are present. This test can be hard to perform in younger children. Or finally, stool antigen test. This test looks for signs of H. pylori in your child's stool or poop sample. Acid-reducing medications like omeprazole, Pepto-Bismol, and antibiotics may affect the accuracy of the breath and stool tests. Your healthcare provider will ask your child to stop taking these medications for 2 weeks before the test. How is H. pylori infection treated? H. pylori infection is treated with a combination of antibiotics to kill the bacteria and acid-blocking medications and stomach lining protectors to help heal the ulcers and reduce irritation in the stomach and upper intestine. The acid-blocking medications also enhance the effect of the antibiotics like amoxicillin and clarithromycin. Antibiotic treatment usually lasts for 2 weeks. It's very important to complete the entire course of treatment to make sure the bacterial infection is completely gone. Even after treatment, it can take several weeks or longer for your child's symptoms to disappear fully. It's important to check that the bacteria is gone, so your provider may order stool tests or a breath test 6 to 8 weeks after your treatment is complete. From first conversations to treatment, Boston Children's Hospital is committed to keeping children and adolescents healthy. For more information, please speak with your primary care provider or visit bostonchildrens.org.